on the Windward and Hawaii Kai side. You can see that. And I am, my day job is with the Adult Mental Health Division, Department of Health, and I've been in mental health for a long time in different roles, and super excited to be with you. I can't see you all now because I shrunk you down, but otherwise I'd say, gosh, could you make sure you put your cameras on so we could really talk. But I did present this slideshow, hoping this might be helpful to you. And also May is Mental Health Month, so I'm kind of excited. This is something I can do for Rotary Clubs if you want more information, but this is just kind of something I prepared for today. So let's kind of talk about why mental health matters. So if you didn't know this, there's 200 classified types of mental illness. So mental illness is one thing. We're going to talk kind of about mental health and kind of your average mental health conditions. But it's pretty astounding that 1 in 5 of us will experience some kind of mental health condition in a year. Now, don't go through the little squares here and go, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, you know. But whenever you're around a crowd, you can imagine that somebody has some sort of mental health condition. And that may be some of us and some of the people in our Rotary Club. So it's good to be aware and it's good to be sensitive to each other. And especially times of COVID-19, then this can exacerbate lots of symptoms. These are some other interesting stats. I tend to work with people that have severe and persistent mental illness. So I'm interested in things like people that are incarcerated, people that have serious illnesses such as schizophrenia, bipolar, and major depression. Today, we're going to kind of focus on your average mental wellness and illness issues, which are most of people that Rotarians are going to come in common with, are people that have anxiety and depression and just stress due to what's going on right now. So why does it matter? Well, often people, because we know that the numbers are so great, sometimes people wonder, where did this come from? So it's really unclear exactly why does somebody get a mental illness, but we know that there's many factors that probably something to do with early adverse life events that could have a contribution. People that might have a chronic medical condition, people probably have some sort of biological factor, some kind of genetics or chemical imbalance. And then also some people have used alcohol and recreational drugs for a long time, loneliness, having few friends, being socially isolated. So lots of different things kind of can contribute to somebody having a mental health condition. These are 4 areas of our lives that kind of are the foundation of something that we can all zoom in on. Basically, SAMHSA is kind of our federal agency that we do a lot of work with, and they've identified, this is very old, but it stays true. And whenever we're talking about a pandemic or we're talking about kind of what are the foundations of wellness, then we think about things that have to do with health, which is today's topic, home, having a stable and safe place to live, purpose, and Rotarians know all about that we give purpose to our lives. And then of course, community. Do people have relationships and social networks and friendships, love and hope? So this is really good that Rotary clubs can enhance these areas, but these are always kind of 4 dimensions that I tend to focus in on. COVID hasn't been all bad. COVID has actually given some strengths to communities. If you think about how we've learned how we've gotten some individual resiliency, we've also had some times of gratitude. And I'd encourage people to take moments of gratitude. We've also had a chance to kind of organize, clarify. Lots of processes kind of went to chaos during the pandemic, but it's given us a chance to organize ourselves, to clarify existing processes, whether that's in our work or our home or our play. We've also done some virtual things that maybe people never did before, more Facebook as a way to connect. People have gotten services that they would have never thought of online, even things like AA and NA, webinar trainings. Look at us, we're training all the time through Zoom. There's been a focus on cleanliness, which that's not a bad thing. community-wide supports and partnerships. And I think probably you might agree that we've gotten more effective at communications because we've had to be more efficient. So I wanted to just point out some strengths, because often I've been talking about really kind of doom and gloom things about the COVID-19. This I made just for our group because I think that mental health and Rotarians, I think it's good for us to just kind of think about and give a moment to. So I put risk factors for stress. So, you know, more than 2 Zooms per day, that's something to pay attention to. We have to stretch our neck, we have to stretch our back, we got to get up. And so if you're doing more than 2 in a day, I bet you are, it's good to stand up and move around. Otherwise, that can get very stressful. I put focus on substance use because whenever I'm in a group of people, I just assume that probably somebody has a substance use disorder. And so I would encourage your groups when you get together, you know, to always promote alternative beverages, to promote wellness. There's a lot of jokes and, you know, sometimes they're super funny and then sometimes they're too much. So it's really, I know we make, you know, fun of all the, you know, and we do a lot of pauhanas. I attend to, I drink to, but sometimes the focus we have to give some thought to, is it just a little over the top sometimes, because chances are somebody in our groups does have a substance use disorder and is probably trying to stay clean. Overbooking and overloading, does that relate? So, you know, planning and calendaring and delegating, we talk about this, but there's nothing like delegating and getting more people engaged in our clubs, because otherwise we're feeling overloaded. Work, life, volunteer, lack of balance, that's a huge stressor. So another kind of protective action is if we integrate our family more into our Rotary clubs and have good time management skills. Real risk is if we don't exercise. And so it can be very helpful if we make appointments in our calendars to walk or go to the gym or hike. And then Zooming, some of our club members still are struggling with this and they find it stressful. They don't want to do it. It stresses them when we use the word Zoom. And so it may be that we have to actually go one-to-one with them and help them on their computer. And then of course we have Rotarians that have lost people. People have died. People have gotten severe illnesses. This might look funny to you, Sunshine Busy Bee Rotarians, but I still remember my time, I was president of Metro Rotary, and they had something called the Sunshine Club. I've also heard it called a Rotarian being called a Busy Bee. And it was just a couple members that would keep track of people that died or went to the hospital. And so when I had a death, I got a card, I still have it. And it was just people saying, we're sorry for your loss. And that meant so much. So I really hope people are looking at how they address that in their club about losses, because that helps people's mental wellness. Culture, especially here in Hawaii, is a huge factor in how we deal with stress and take care of our mental wellness. Maybe you've been taught to shh, be quiet. If you have a problem, keep it to yourself. Don't go outside of the family. Don't ask for anything. Maybe you've been taught that it's a weakness, but actually it's a strength to say, I need some help. I'm struggling. It takes a lot of strength to say I'm struggling. So keep in mind that culture, where people come from, what customs and values people have, does influence how we address mental health. If we do want to address it, it feels like this often. Where do I even begin? What do I do? The mental health system, and I work in it, is really hard to navigate. So which way do I go? This is my little slide on self-managed care, because we work in a managed care healthcare system. That's a whole nother workshop. We don't have time, but I could help you with that if you want. But this is kind of a little slide on self-managed care. talking about, what is my spiritual connectedness? What does that look like? Maybe I need to take some time to explore that. Medications, am I making that a priority? Do I have enough refills? Am I really connected and have a relationship with my doctor, my family? Sleep. You might want to look at how's your sleep been this week? Are you getting enough? Food and water, have behaviors changed? We already talked about exercise, but also relaxation. I talk about managing my care providers because sometimes they think they, manage us, but actually we have to organize all our care providers, make sure we have all their information. We're keeping our regular appointments. Did you have your annual last year in 2020? A lot of people didn't because they were busy doing other 2020 things. Meaningful daily activities. I think most of us have that down because we're Rotarians. Leisure and social networks, and then of course our jobs, and many people's jobs has been affected. What if we have to go to outside help? I wanted to make sure everybody has this. This is our system through the Department of Health. And this number, this is for Oahu, and then this is for neighbor islands. But Hawaii Cares is kind of our centralized coordinated access resource entry system. That's a big mouthful, but this is how you get to anything in our state system. But it's also a good number to know if somebody comes up to you and says, I need, I have a friend of a friend, because they'll never say domestic violence is probably in their home, but they might say a friend, domestic violence, children's care, elderly care, any kind across the board resources, people can get help here. This is a brand new service for COVID. So it will end October 10th. It's special for extra stress that's going on during this time. It's a FEMA grant. And so when you do call that 1-800 number, you ask for Kumakani, and somebody will just talk to you. Somebody will just be there available. And so maybe you don't need this, but maybe your employees do, or maybe your neighbors do. This would be the drastic end of the other side of mental wellness, which is when people have given up on hope. But is that serious? I want to mention it because it does happen. And this is pretty amazing that every 15 minutes, somebody does take their life. And so a lot of people, even physicians, by the way, can go through, I've talked to physicians that have gone through medical school and they say, you know what, I wasn't really taught about suicide prevention or what to ask or what to do. But 45% of people saw their doctor in the last month. And yet they did die by suicide. And so we're trying to do a lot of suicide prevention by saying, you got to ask the question. It's uncomfortable, but it's okay if you suspect somebody is really doing poorly to go ahead and say, are you thinking about killing yourself? Even my throat feels weird when I say that. It's not an easy question. And of course, we're really afraid of what the answer is. But it's important to have those conversations, to ask the question. There's a lot of information on afsp.org. I co-chair the local chapter for Hawaii. I encourage you to use that resource and maybe even think about getting involved with Hawaii's chapter.
Hey, sorry, Kathleen, just want to interject. Just a common misbelief or misperception that asking someone about suicide actually can maybe increase their risk or get that thought into their brain. That's not true. It's actually the opposite.
Thank you.
So asking about suicide, asking about if they have guns or knives or access to dangerous things in their house, those questions actually don't actually increase suicidality. So just
Absolutely.
Asking helps. So just kind of keep that in mind.
Thank you. Thank you so much, James. Absolutely. And then I know I whipped through those, but I wanted to, I can, if you want this, I can share these with you too, so you don't have to worry about writing them down. But these are my favorite. I use them all the time. They really are in my favorites toolbar. Some great resources. National Alliance on Mental Illness is one of my favorites. MHA Mental Health Hawaii, and these are just some of my favorites, go-to resources. So I'm going to stop sharing so I can see you and so that I can get your reactions, because I did go through a lot. Oh, there you are. Hi.
Oh, Laura's here. Awesome.
Mark just reacted. Should we go
Hey,
to,
Kathleen.
yeah,
Yeah, I just had a question about COVID fog. I don't know if you guys have heard that term before, but there's actually a lot of people who have had COVID who for several weeks, and unfortunately even the long haulers still have this fog, and it's almost quite sad to see some of my friends who actually were probably the brightest, and they actually now act like they've had a brain injury, like like those football players when you had too much, that kind of idea. They're slow to respond to questions. Even some of my colleagues that were really high functioning. And I just wanted to see if maybe you had any information or data on that, on maybe the long-term mental effects, not just the actual secondary effects of COVID, but actually directly the actual physiology of COVID affecting mental health.
I would love to know more about that. I think what we're talking about is the long-term effects of this kind of stress, and also just what's coming. I'm very concerned about what will be coming. People, I think, they went through the shock mode. Now they're kind of in the recovery mode. And then, of course, now there's a whole new wave of stress. People are worried about coming back to work. Their kids going back to school. There's a whole new layer and phase of this pandemic. But the physiological, you're right, that fog, that's very interesting. I think, again, we're in it for the long haul, and I think there are long-term devastating effects. So time will tell, but we have to prepare, because we have to sustain ourselves. We have to pace ourselves as well, right?
Correct. And then also the fact that COVID affects people's sleep patterns as well. So keep that in mind too. Like there's actually quite a bit of literature on people who just aren't able to sleep as well as they used to, or they have these what they call COVID nightmares, especially during the acute, the highest peak of the viral shedding in their bodies. They actually have these like overwhelming nightmares of doom and death. It's actually quite documented. It's kind of scary. So, and then the later effects of that, because then people are trying to deal with that, and they deal with substance abuse to kind of maybe quell those ideas or those thoughts, or maybe use substances to kind of go to sleep.
Yep.
So yeah, I really appreciate this topic, and I think this might be something we want to expand upon as one of the focuses that the District Health Service Committee wants to kind of move forward with, Kathleen. So thank you so much for the presentation.
Oh, thank you very much.
Let me see here. Did you guys just want me to kind of jump in, and then maybe we could have some questions, or do you guys want to do some questions now in between? I'll just kind of jump in for a quick little, it's going to be just a quick update. That's literally what the title of my presentation is, but is it okay if I get access to be the co-host? Family, thank you.
Oh, you can share screen now if you.
Okay. Oh, perfect. I'm on it right now. Thank you. Okay. Give me 1 second. I want to make sure I get onto the right screen when I actually share. Okay. Here we go. All right. I'm going to, hopefully I could full screen this as well. Are you guys able to see full screen on this one at least? Okay.
Yeah.
Cool. Okay. All right. So just a really quick update. My name is James Ham. I'm actually an emergency physician at Straub. I'm also an assistant clinical professor at the University of Hawaii. Who's been doing a lot of Zoom teaching, and just more recently we've gone back to in person. So I'm really excited. But with that said, all these decisions to go back into school, back into our in-person Rotary meetings has to do with a lot of our data. So this is the latest that we've gotten from Department of Health. Obviously 98 new cases yesterday, just a quick update. Seems like Kauai is doing a great job, especially with their high intense lockdown. So actually it's proven to actually reduce the number of cases. Kudos to them. I know the cumulative total cases, is we've had 31,000 out of these, 100, 90 or 100 or so per day. We're about 1,300 or so total people in the islands that actually have active COVID right now. So a lot of people actually, statistically, they kind of think, oh, we had 90 something people yesterday, so there's only 90 people roaming around. No, that's 90 new cases. So you have to think of the terms of prevalence versus incidence, right? So, you know, we only have, just because 90 new cases, there's still 14 days or so of infectivity that we kind of worry about. So that up, and it's about 1,300 or so people that we have right now in our state. Just some basic tips. That's kind of the point of this lecture. I think I just wanted to kind of obviously open up to questions, but you know, make sure that, you know, the first like couple pretty basic. We've all been doing this. I just touched my face as I talk to you guys right now, but you know, just making sure that you stay vigilant with that kind of stuff. It's pretty basic. I think you know, we are in a very hands-on kind of culture. Definitely, you know, the kisses on the cheek in between meetings with people in Hawaii. That's something that I kind of picked up 11 years ago when I first moved here, and it's just not happening anymore. But moving forward, like the next level is level 3, right? Just get vaccinated. Make sure you and your families are getting vaccinated. I think that's the biggest next step. And you know, we're already approaching almost 30% of our state, and we're kind of excited. There's even some countries like Bhutan who are approaching 95%, you know, vaccinated. So, you know, we're super excited about hearing those stories, but, you know, hopefully we'll be able to get in on this. Get tested, even if you're sick, even if you're vaccinated. That's the other biggest thing I've noticed. People are sick and they are like, oh, I'm vaccinated, I'll be okay. So just keep in mind that you can still get sick even if you're vaccinated. The vaccine will prevent you from having to go to the ICU, but it won't prevent you from getting sick. So keep that in mind. So the vaccine actually slows down the you know, the really kind of heavy hit of the virus on you. Continue regular checkups. I think a lot of people in this past year delayed their checkups. They're using telemedicine as an emergency physician. Unfortunately, I'm going to just maybe an anecdotal kind of bit of advice, but I see a lot of problems, unfortunately, coming into the emergency department, primarily because they've seen their primary care doctor 2, 3, 4 times on video, and they aren't really showing their doctor their rash or their foot, or the doctor's able to listen to their lungs or check their vital signs. And they're just relying on their home system. So keep that in mind, that going in person can help. It's, you know, clinics are safe. You know, there are definitely measures in place. And make sure you're following with your follow-up appointments. Just because you feel better doesn't mean that you should follow up with your doctor. You know, get those repeat lab tests done, things like that. And this kind of this next staying active. You know, I think having that purpose, staying physically active, staying mentally active, making sure that you're talking, making sure that you're able to kind of relate. I think this next opening up phase, you know, we all worry about people overdoing it. I don't think so. I'm kind of still worried about people still being recluse, still being comfortable with Zoom, still not wanting to go out and go to these in-person meetings. So I think just encouraging that, making these phone calls, especially to some of the elderly members of our Rotary clubs, you know, get them kind of reconnected. You know, maybe even, you know, if you're safe, if they're okay with it, you know, stop by their house and do home checks. These are all things that we probably were afraid to do before, but I think we're now more comfortable doing. And then, you know, I think Kathleen mentioned it, you know, staying away from alcohol and substances and trying to reduce that, obviously use them in moderation, but ultimately, you know, some of these fruits and vegetables, you know, I'm not a dietitian, but there is a strong correlation, obviously, with antioxidants and making sure you're getting your vitamins to kind of help your liver and your kidneys and your vital organs, as well as your immune system. So the big concern right now is Johnson & Johnson, right? This is one thing I wanted to address with you guys. And these are the 2 latest news articles, literally within, one's within 24 hours, one's within 12 hours. And obviously, you know, as a state here, we've been asked to kind of stop vaccinating using the Johnson & Johnson vaccine. They definitely have researched this quite a bit. You know, obviously people are questionable about science these days. People are questionable about whether or not a private company who's actually financially invested should be doing the research. So, you know, they've even asked other, you know, their competitors to even kind of do the data, and they still haven't found any real data that actually is convincing, in my opinion. So just to kind of throw some numbers out there, you know, they're saying that we've had 6 cases and 6 women, which is another something to be interested about. You know, I'm trying to figure out why it is women instead of men, but it could just be, you know, just by the luck of the draw. We don't have enough data yet to actually distinguish that. But 6 cases and 6.8 million doses, that's about 0.88 cases per million. And just think about the risk. For birth control pills, you have about 50 to 1,200 cases per million of blood clots. Cigarette smokers have about 1,700 cases per million, and COVID-19, 165,000 cases. So just kind of, keep these in relation that birth control pills are still, people are still using those, pretty frequently. People are still smoking like crazy. I would actually kind of like to see the number of people who are smoking who are talking about this concern about the J&J vaccine and blood clots. But moving forward, that's just kind of the numbers that are there. I'll let you guys make the correlation on your own, but it is a very low risk. This was just an email that was sent out to us at Hawaii Pacific Health, just to kind of share with our patients, share with our community. And if you've been vaccinated, more than a month ago, I wouldn't worry. If you've been vaccinated in the last few weeks, still very low. I still wouldn't worry, but you should look out for some symptoms. If you're having a really, really severe headache, and that's this CVST, this cerebral venous sinus thrombosis, this blood clot kind of that goes to your brain and causes a stroke. I would actually like to see if those 6 women actually had other kind of things. Were they on birth control? Were they on other kind of were there other factors that may have caused this? There actually is a correlation with women and cerebral venous sinus thrombosis as well. So kind of keep things in mind as well. So, but look for these complaints, these symptoms, and if you have them, you're really worried, go get checked out. That's kind of the key. No one's saying not to go get checked out. If you're worried, come on in. We'll be happy to see you. And just also keep in mind that the Pfizer Moderna vaccines have been, they haven't had any incidents of CVST yet. We don't know. If there is a few cases that come out, I'm not certain as to if they're related or not. But just kind of keep that in mind. And I think ultimately, just make sure that you're staying in tune with kind of the news and what's going on with this. So I think that's pretty much it. Just wanted to just kind of give you guys an update on some of the concerns that my circle of non-physician friends and Rotarians were asking me about in the last week. And I thought I'd share in a kind of down to earth kind of a system here. But ultimately just wanted to see if around the horn, if anybody had any specific questions that I could try to field. Like I said, I'm no expert at this, but I can at least, if I can't find the information, I'll definitely find someone who can. So feel free to fire away.
James, do you think can you still come down with COVID after having the shots? The first?
Yeah, actually there have been cases, obviously that, that 93% effectiveness, 96% effectiveness, those numbers come from obviously 7% or 4% of the people actually, testing positive afterwards. Unfortunately, we don't have the test capability here yet. I just had lunch with a friend visiting from Stanford who's an anesthesiologist there. He gets tested every week. The entire medical staff gets tested every week, and they actually have their testing is so specific they could actually test if you actually are viral shedding or actually are infectious or not. So it's actually quite interesting that there's different level of testing, and I'd like to see kind of what the level of infection people who've had the vaccine had. But the other good news is that at least with the Pfizer and the Moderna, the Johnson & Johnson still hasn't had enough data yet to kind of give us this, but there have been 0 deaths with from COVID related. Obviously, there was an anaphylactic case in California from an allergic reaction, some other things, and also these cerebral venous sinus thrombosis cases. But actually, from COVID itself, COVID infection, there really hasn't been any deaths, and it significantly reduced the ICU burden, which is kind of the point of having the vaccine too. So, as far as not to put you on the spot, Scott, but I know you got your second shot, and I'm excited to hang out with you today, just personally, and I'm excited to invite you over to our club. And we have no requirement for having a vaccine, but vaccinated to come to our in-person meetings. But we definitely want to make sure that we increase that, and I think that's how we'll get it. And I think Rotarians, service above self. we tend to care about others more than ourselves sometimes, but that's a good thing, and sometimes it's not. But I think we definitely mask up and make sure that we care for others. Jim, what's up? Go ahead.
James, how do you see the Rotary clubs evolving? You must have talked about this, and certainly Naomi, I know, can step into this. We just did a survey in our club, just asking members about would they attend a meeting, would they pay, how do they feel about, the distancing. And some of the older members are reluctant to come in person. I was just wondering if you have a feel for this from a medical standpoint, and I've had both the vaccines. I was just thinking, would we go to a meeting and say, okay, you guys that have had the vaccine, you sit on this side, you non-vaccine people, you 6 feet apart on the other side, and and the ones that have had the vaccine, we'll go to the buffet. You other ones, we have a box lunch for you or something. I mean, how does this evolve?
Yeah. Or do you pair a vaccinated person with a non-vaccinated person and have them hang out? Like I totally get these questions. These are very. I agree with you. And again, it's we opened up in Argentine here as well. We opened up about 2 months ago. Argent, would you say when we were allowed to? And we actually opened up with first with limiting our seating, and then obviously with the Waikiki Yacht Club kind of opening up and restaurants opening up more. We definitely have been kind of a little bit more robust and. I think the measures that we're taking are just like any other restaurant, and I think we're probably better because we actually easier to contact trace, right? Because we know our own members, right? But going back to that, we aren't doing a buffet. We are doing plated dinners. The staff has actually been very nice there. We don't, and oh yeah, Liz is here too. Sorry, Liz, I didn't recognize you as well. But we have been actually doing a pretty good job. And like initially we started out with kind of like a menu, off the menu, kind of treated like a restaurant, and then we kind of depending on how big our size has been, just to help the staff there, we've been kind of having a preset, still plated lunch, dinner. I mean, but it's been working out okay. And presentation wise, we had an in-person meeting a couple weeks ago, and I think that it was I think challenging in terms of Zoom, but in terms of the COVID concerns, again, and going back to the elderly, I felt like the first the open meeting that we had a table of the elderly that were there, and I think because they were vaccinated, they were the first one to get vaccinated. They were the ones that were most willing to come in. I felt like. But some of them, it depends. I think it's all personal preference. By no means are we trying to push one side or the other. I think our hybrid system is actually going really well. Between Win Chodeman, Jim Hoban, we actually have a video camera that kind of helps kind of things. Our speakers, we actually give them the option also presenting from home via Zoom as well. But I totally get you. It's going to be a work in progress. I know that there are some guidelines from not guys. I would say just recommendations from Rotary on how to run a hybrid meeting. And Arjun actually had I wouldn't say formal guidelines. I would say just from different Rotary clubs, Rotary channels. But Arjun actually has done a great job of actually bringing in a system that was meant for Zoom in the classroom, where we have a TV screen with a speaker bar and we have a separate microphone. And we finally got it after about how many, like a year and change, because we tried to open up in June last summer too, right? And that was a chaotic disaster as well. So I think we finally have something down, knocking on wood, barring no other kind of challenges. But now we're just kind of waiting for things to open. And I don't think we're going to go back, honestly, to full without this. I really like this idea. And, our club, I think all the clubs in Hawaii have members that travel a lot. I think Rotarians themselves are just always on the move. So I think there's always going to be 1 or 2 members, if not more, that are going to be, away off island or another island or et cetera. And I think this hybrid system is perfect. And I think we all envision this, this makeup meeting kind of concept of just turning on your phone. I mean, I'm embarrassed to say I've been literally on an airplane waiting for it to take off in a Zoom meeting with Rotary, right? So it's definitely possible, and I'm looking forward to it. And again, Jim, welcome to have you come visit us too when things allow too. So you're more than welcome to come join us at the Yacht Club.
Yeah, I'm coming over. I'm coming over soon. I've been talking to Arjun about it. Yep.
Right on. Happy to
Yeah,
have you.
mahalo, James.
If I could add something too, I'm in Denver right now, and I had a meeting this morning where past Rotary International President Ravi, and he said the trustee chair of the Rotary Foundation, and he's encouraging us as Rotarians to look at what the concerns are with our fellow Rotarians, are not just Rotarians, but those around the world who are negative about taking the vaccine or having the vaccine administered to them, and see what their concerns are, but encourage them to take it, because there is no alternative to not taking it, but what we've seen in the past. So what they're doing is asking us to kind of encourage, because what they're looking at now, there's only 1% of the 1% of the people in Africa have been vaccinated so far. So they're looking at the fact that if it continues along this line, it's going to be about 7 years before the world is vaccinated against polio, against this pandemic, this COVID-19. So let's play our parts as Rotarians and just listen to what they say and just show the oppositions of what could happen if you don't take it or if you don't have this vaccine. So quite interesting information. And they, like us, we look at the fact that we're having the Zoom meetings, but the hybrid is going to be something that's going to come into effect, and it's going to be there for a while until we get a leverage on this. But a hybrid is not all bad, because it does give you the advantages of both in person and on the network. So very interesting information coming from National.
I think Mark had his hand up. Mark,
I'm sorry.
did you have your hand up?
Oh, I had a question for Arjun. I'll follow up with him later. I was just wondering if the system you introduced from the classroom was a Zoom system.
Mark, it's in the Zoom system, and if you do like how to do hybrid in Zoom, hybrid classroom, in the university's classes, it's very common problem. You want to have like a hybrid, because there are people,
Yeah.
students online and also the face-to-face. So because of that, Zoom has a one page just dedicated for this, how to do your hardware, and software is already there. It's just matter of everything hardware. And
That's awesome.
it's
I'll follow up
interesting.
with you later. Yeah.
It's interesting. This is talk about more health, and it ties to our earlier conversation about diversity and inclusion, because when we do this hybrid, obviously we're giving choice, accepting people who don't feel comfortable to come personally, and also those who are joining online, accepting comfortably those people going online, having going to the face-to-face meeting and enjoying the dinner. So this really ties with that. And thanks.
Arjun, maybe you should do the training on this with district-wide for clubs to consider.
So Benson and I are working on training on this, and so we'll have that up pretty soon for the clubs to see not only the hardware part, but how to do a good Zoom. And so it's how do you position your face, your gestures, your screens, and so we'll be working on that as well. But the question about having hybrid is probably going to stay. And for Honolulu Sunrise, they have a hybrid membership category, which is 50% of dues, and because people,
that's awesome.
Yeah, and Arjun is right. For DEI, we need to consider people who don't want to come, or they just don't have time, but they want to be as part of your meeting. So we need to really think of different ways to be flexible. Sometimes you don't have the equipment, so what are the alternatives? So we'll cover that in the training on Zoom. But we should never require people to come in person. It's always going to be optional, and we need to respect whatever their opinion is.
Yeah, and another option I was considering is obviously just joint meetings as well. Obviously opening up the hybrid meetings to others. So for example, if a club is having in-person meetings, they don't have the technology yet to actually incorporate the hybrid. Adopt another club's hybrid meeting into theirs, and find a way to do this. Hey, Jim, actually, I'm sure Arjun wouldn't mind a trip to Hilo also to come visit your club as well. So it'd be kind of cool to head out there. It's been a while since I've been to Hilo. But anyway, with that said, any other questions? Just trying to see if, from a health perspective, you know, just wanted to throw it out there too, that I said in my presentation, but I just feel like a lot of people are pushing off, you know, whether they call them elective surgeries or their health ailments or these kinds of things. And I just want to get the word out there that, you know, it's, you know, as we're talking about going back to these in-person meetings, we should always be talking about going back to our in-person doctor visits and our in-person kind of just routine stuff, you know, and I think that's going to get us back to life. That's going to get us back active again, mentally active again. And yeah, these projects. So just a plug for this Saturday, I hope everyone's going to this beach cleanup or at least supporting it somehow. The Reef to Ridge. It's a great outdoor event and I'm looking forward to it. It's actually really cool. I didn't realize how many people were actually going to be involved, but it's going to be an amazing day. So we're looking forward to it. Yeah, so that's my health promotion topic event for this Saturday or this coming Saturday.
Questions for our subject matter experts? Maybe Al, you can share what's going on Maui with your group.
Well, I joined the district health committee that James Ham is on and Claire Schnurr, and got a number of ideas from them. And so we have set up a Maui-wide Rotary Club Health Task Force. We have run one vaccination event. We have another one coming up on May 1st. We're targeting the Native Hawaiian and Pacific Islander populations with information than a flyer that was used in Hilo. So I think we're trying to steal shamelessly from the work that people are doing on the other islands and then apply it here. And there is a lot of vaccine hesitancy among those groups. And there's some misinformation that is actively being just put out in some of the churches. So we're having to work on connections wherever we can. These are not folks who tend to read the general newspaper, so we're trying to use the coconut wireless approach and get influencers in every one of the communities that we can, and we'll see how it goes. We've been partnering with the County of Maui to distribute PPE to nonprofits, and that has worked very well. And now we're partnering with Kaiser Permanente to run the vaccination clinics. So that's what we have going on.
I have one question related to this on the vaccine, particularly for Naomi, I think. So there are Rotarians who have not vaccinated, and it seems they are reluctant to get vaccine. They don't want to. And when we do Rotary activities, for example, service project or face-to-face meeting, what is there like a particular guidelines or policy? So do we discourage those who have not vaccine, or do we encourage them equally? Or is there a policy when it comes to decision making, how to decide? Is there any?
Yeah, there is no policy, but because we need to be respectful of their opinion, you need to just take the precautions that, you know, if you do have someone who refuses to get vaccinated, that maybe you like there's this joke at the Honolulu Club that this person didn't want to get vaccinated, so nobody sit with them at their table. But you know, you just need to take the precautions with the distancing and the masks.
Okay. But can we ask or not? Is it okay to ask members if they have vaccinated or not?
I don't see why not, but it's voluntary, Arjun. It's okay to ask, but they're not required to give you the information, right? So I think that's the key. And you know, obviously being in healthcare at work, it's different as well. But we even put a little sticker on our badge that says we're vaccinated. But
Okay.
For some reason, I'm on night shift, so I haven't gotten my sticker yet. So I get the weird looks from people at work, thinking that I'm like an anti-vaxxer at work because of I don't have my sticker. So it's all matter of preference for asking. You know, like I said, we're not gonna get in trouble for asking, but we're not required for them to. We can't discriminate against them if they're not vaccinated. Put it that way. Yeah. But you know, it's quite interesting because you know, like there's a big anti-tuberculosis kind of you know, thing that happened you know, here in Hawaii. It's still going on, right? When you come to island, and as a you know, they always want to make sure that you've not bring tuberculosis from outside the country, right? So it's just, I just thought that was interesting. But we could require tuberculosis screening, but we can't require COVID vaccination screening. But
Okay, but we could say that anybody going to Nepal has to be vaccinated. So thank you very much, Kathleen and James. And we're going to be starting our next session at 11:20 for international service. So you can take a break, but in the break, hey, James, everybody, if you haven't seen that James was named as one of the people of action for Rotary.
Yes, yay.
So James, hey, I got some pictures for you. I'm going to stop sharing, stop recording.